And joining me now is Dr. Alan Katz. He's a faculty professor of public health over at the University of Hawaii at Manoa. Good to have you on the show, Dr. Katz.
Thank you very much.
And I know as an epidemiologist, you are at one of these forefronts of studying and researching what's happening right now. What is your initial kind of insight into what's happening here in Hawaii?
I think we are at the beginning of the trajectory, and I think that we have had a fortunate opportunity to have some interventions that other locations haven't had. The fact that we have the isolation of being an island state, the fact that lots of our population live in rural areas, and the fact that we have, I think, a very strong leadership group that is coming up with very important mandates, regulations, and recommendations, I think have put us in a much better position than other states. The travel advisory, the stay-at-home, closing down large places where people populate, like the UH system, the schools, the stay-at-home order. These are extremely important because right now, social distancing is the key to mitigating further person-to-person spread.
And a lot of discussion on our methods of testing. There's criticism that perhaps we should be expanding it to include asymptomatic patients or people that may not be knowing that they are spreading this. What do you think about that?
So I will say that, for whatever reason, the initial startup was not optimal. Even Dr. Anthony Fauci from NIAID, who is the sort of front for the best of the public health notes on the pandemic, has said it was a failure. Right now, we're doing catch-up. We are short of test kits. We are desperately short of personal protective equipment. In order to do testing of people, the healthcare providers doing the testing have to have protection because the nasopharyngeal swab that you read about, sticking the swab deep into the nose, that can actually cause aerosolized virus. So the person doing the test has to be protected, her or himself. And because personal protective equipment is at a premium, we don't have enough. We don't have enough globally. We don't have enough nationally. If we have a spike here in Hawaii, we may not have enough here in Hawaii. We need to keep that personal protective equipment for the healthcare workers on the front lines, taking care of ill patients. If you have someone on a ventilator, you have to do multiple changes of the personal protective equipment. It's not just, put it on in the morning, take it off at the night. If you're going to be, intubating a person, if you're going to be getting suctioning from their ventilator tubes, you're going to have to be doing multiple changes. If you have more than one patient, you're going to have to do multiple changes. And if we use up all of our PPE, testing everyone who wants to be tested, that's going to be a crisis. In the best of all possible worlds, we'd have plenty PPE, we'd have plenty tests, and we could expand our testing. I've been very heartened looking at the news reports that the Department of Health has put out on the number of tests. I mean, the COVID news that is posted almost on a daily basis by the Hawaii Department of Health, I think, has been really exceptional. And they put in how many tests they're running. They put in how many people are positive, how many people are negative. And the last data that I saw was over 12,000 tests cumulatively have been run in Hawaii, which is not great, but compared to the other states in the US, it's very impressive. So, we're working under less than optimal conditions, and that's a gross understatement.
Well, that said, when you talk to the physicians that are seeing patients that are concerned, they're working in high-risk jobs, like tourism, again, they want more to be done. And now I know we see some doctors trying this blood test, to see if there's antibodies, that people have been exposed, but they may not necessarily have it anymore. What do you think about that?
Okay, so the antibody test, the only FDA authorized test for antibodies from I've been reading the FDA website was just approved within the last day or two. There's other tests that are being used, but there's only one that's being authorized for emergency use by the FDA. That will be extremely important. That will allow us to see what the denominator is. How many people in the population have actually been infected. There's so much about this pandemic that we don't know. We don't know, who is infected. We don't even know the case fatality rate because we don't know how many people are infected that may have subclinical or asymptomatic infections. Once we have control, and I think right now we're sort of in crisis mode, we're trying to deal with the spike of very sick people and people that may need intensive care interventions. Once we get a handle on that, then we could move on to the second phase, which is getting testing of people, doing contact tracing, finding out how many people in the population are infected with the antibody test, which is extremely important. Antibody test is going to be a great tool for clearing up lots of unknowns with this pandemic.
And another thing we're seeing is these drugs that were used to treat other illnesses like hydroxychloroquine, a sleeping drug that has treated some patients as well. What do you think about these alternative options to treating patients who have the coronavirus?
Okay, I think there is pluses and minuses. I sort of came to maturity during the HIV epidemic, and the drug lag in getting medications approved was unacceptable. We had people that had death sentence. They had no FDA-approved medications, and they basically had to go to alternative care. The NIAID, Dr. Fauci, he was the head guy then, allowed for compassionate usage approvals and also parallel testing where we continued to do randomized clinical trials, but on a compassionate basis, people could have access to medications that showed that they were at least safe and had some hints of efficacy. So I think on a basis like that, it's a good idea. I think physicians now hoarding and prescribing hydroxychloroquine and patients that have lupus that actually need it to be able to live and have any kind of quality of life is really not optimal.
And just in general, Dr. Katz, what is your advice to kind of calm the public down? I mean, there are still some concern that people aren't social distancing and people just are not quarantining, even if they feel like they are or have been exposed, and then going home to multi-generational households with multiple people in their homes. So, what would be your advice for people watching?
That's it's a good question. I hope, I believe, I pray that people are taking the recommendations, the mandates, the legal, these are legal things that the governor and the mayor have put out about, staying at home, not aggregating. I hope people are taking this seriously. I know that early on, there was lots of media focus on adolescents, young 20s, at spring break in Florida who were partying and COVID wasn't going to impede their partying. I think even some of them have come out and apologized for their irresponsible behavior because, they didn't see it as being a major health threat. This is the biggest health threat of our lifetime. This is back to 1918. If anybody wants to sort of get an idea of what's happening globally, it would be, wonderful to do some historical reviews and look at the 1918 pandemic, which was devastating globally and in the US with lots of illnesses, lots of deaths. But your question about what other things, I mean, it's important not to get immobilized and paralyzed by fear. You need to take precautions. And I think the social distancing is extremely important. I think if you're not an essential worker, stay at home. These are things that can dramatically impact further transmission. And it's been shown to be helpful while we're flattening the curve goes down, we're successful, then we get into the more aggressive testing. We can do antibody testing to get a better idea what's going on. The vaccine trials are ongoing. There's lots of medications being tested by randomized clinical trials. So, and our ingenuity is second to none. I think we're going to be able to address this. I think we'll be able to get a handle on this. It's going to take some time. It's not an overnight solution, but I feel very optimistic.
Well, that's good news. We need a little bit of optimism in these trying times indeed. But good to have you on the show, Dr. Alan Katz with UH Manoa. Thank you so much and keep up the good work there.
Thank you very much.